In this video, we break down the 7 essential tips to maximize the effects of Tadalafil so that you can improve your results, boost confidence, and get the most out of your treatment safely and effectively. Most men won't bring it up, not to their partner, not to their friends, and sometimes not even to their physician, but it's there quietly gnawing at their confidence, their identity, and their relationships. Whether you're in your 40s or pushing 60, chances are you've either used Tadalafil, commonly known by its brand name Cialis, or at least considered it. It's one of the most commonly prescribed medications for erectile dysfunction, and yet many men report inconsistent results. One day it works, the next day it doesn't, or it takes too long to kick in, or it fades too quickly, or maybe it never quite delivers the confidence you were hoping for. But what if I told you that much of this confusion is preventable? That Tadalafil's effectiveness is heavily influenced by how and when you take it, and what's happening in your body before and after you do. We're not just talking about a pill here. We're talking about vascular function, neural signals, hormone balance, and lifestyle. And if any one of those systems is off track, even the most effective drug in the world can feel like a coin toss. Let's also be clear, erectile dysfunction is not simply a quality of life issue. It's a medical issue. Numerous studies, including a pivotal 2011 paper published in the Journal of the American College of Cardiology, have shown that ED can be an early warning sign of cardiovascular disease. In fact, ED often precedes a heart attack by several years, because the same small vessels responsible for producing and maintaining an erection are often the first to show signs of endothelial dysfunction or arterial stiffness. So when you take a medication like Tadalafil and don't get the results you hoped for, it's not just frustrating, it's diagnostic. It's data. Your body is telling you something. And then there are the internet myths. Social media is flooded with quick tips, unvetted testimonials, and supplement ads promising instant performance or natural alternative. Real erectile health requires more than a shortcut. It requires understanding the system, because this is about physiology, not just pharmacology. Tadalafil is a phosphodiesterase type 5 inhibitor. Its job is to relax the smooth muscle lining of blood vessels in the penis, increasing blood flow during arousal. But like any system that relies on multiple switches being flipped, one faulty circuit or one poorly timed input can shut the whole thing down. So, what's at stake if you misunderstand how Tadalafil works? You risk blaming yourself for a failure that isn't yours. You may miss early signs of a more serious underlying condition such as diabetes, hypertension, or vascular disease. You might misuse the medication, increasing the risk of side effects or diminishing its efficacy over time. And you may lose out on something even bigger, the ability to feel sexually connected, not just physically, but emotionally and relationally. Now here's the good news. These outcomes are not inevitable. In fact, the research is clearer now than ever. With the right adjustments and a more accurate understanding of how Tadalafil interacts with your biology, you can significantly improve its effects, often without changing the dose at all. Tadalafil is one of the most extensively studied medications in men's health. Originally approved by the FDA in 2003, it has been rigorously tested in thousands of clinical trials. And yet, misinformation persists, even among otherwise health-literate men. Let's begin with a very common myth, that Tadalafil works instantly. It doesn't. While the package insert advises that it can begin working within 30 minutes, clinical pharmacokinetics tell a more nuanced story. A 2016 meta-analysis in the Journal of Sexual Medicine found that peak plasma concentration, the point at which Tadalafil reaches its maximum effect in the bloodstream, typically occurs around 2 hours after ingestion. In other words, if you're hoping for spontaneous results 15 minutes after taking it, you may be setting yourself up for failure. There's another misconception, that taking more will work better. But Tadalafil doesn't scale linearly. More doesn't necessarily mean more effective. The typical starting dose for as-needed use is 10 milligrams, though it can be adjusted by a physician to 5 or 20 milligrams based on your response and tolerability. For daily use, 2.5 to 5 milligrams is often sufficient to maintain consistent vascular readiness. Doubling the dose without medical supervision doesn't just increase side effect risk. It may actually reduce efficacy due to desensitization or suboptimal timing. Now, here's where science adds critical clarity. Tadalafil is absorbed through the gastrointestinal tract, specifically in the small intestine. And like many orally administered medications, its absorption is influenced by what else is in your system. A high-fat meal can delay gastric emptying, which in turn slows the drug's uptake. This doesn't mean you must take Tadalafil on an empty stomach, but it does mean that if you've just had a ribeye, loaded baked potato, and a glass of red wine, your body may be prioritizing digestion over circulation. Speaking of wine, let's talk about alcohol. Here, the interaction is both both pharmacological and physiological. Tadalafil is a vasodilator. Alcohol is also a vasodilator. When taken together, especially in large quantities, they can amplify each other's effects on blood pressure. This can lead to dizziness, headaches, or even fainting. The British Journal of Clinical Pharmacology outlined this interaction in detail in a 2008 controlled trial, noting that more than 2 standard drinks can significantly impair both erectile function and drug absorption. Then there's grapefruit juice, often overlooked but highly relevant. Grapefruit contains compounds responsible for metabolizing many drugs, including tadalafil. When you inhibit it, you effectively raise the concentration of tadalafil in your bloodstream, increasing the likelihood of side effects such as flushing, muscle aches, or visual disturbances. The interaction isn't guaranteed, but it's well documented in pharmacokinetic studies. Another myth worth addressing, that tadalafil is a magic bullet. It's not. The drug enhances erectile capacity by improving blood flow, but it doesn't initiate arousal. That part of the equation still requires neural, hormonal, and emotional engagement. No pill, no matter how advanced, can create desire where it doesn't exist. This is why sexual stimulation is still required for tadalafil to work. As the Harvard Medical School Men's Health Watch succinctly put it in a 2019 review, these medications enhance the signal. They don't start the engine. Now here's something most men don't know. Your body needs multiple consistent trials with tadalafil before you and your doctor can accurately judge its effectiveness. A 2020 position paper from the American Urological Association recommended that patients try tadalafil under different conditions before determining whether a dosage adjustment or different medication is needed. And finally, let's address the idea that if tadalafil doesn't work, it means you're out of options. That's flatly false. A poor response could signal several things: poor timing, lifestyle factors, hormonal imbalances, or vascular disease. In some cases, daily dosing rather than as needed leads to better outcomes. The key is to treat tadalafil not as a destination, but as a diagnostic tool, one piece of a much larger clinical picture. To truly maximize the effects of tadalafil, we need to understand what it's actually working with inside your body. At its core, erectile function is a vascular event triggered by neurological signals and modulated by hormones. That may sound complicated, but think of it like this. Your brain sends the signal, your nerves transmit it, your blood vessels respond, and your hormones support it. If any of those links are compromised, the outcome falters. As we age, the endothelium becomes less flexible, plaque builds, nitric oxide production declines. A 2017 study published in European Urology showed that men with cardiovascular risk factors, such as high blood pressure, high cholesterol, or insulin resistance, had significantly lower responses to PDE5 inhibitors compared to otherwise healthy individuals. In short, tadalafil can't do its job well if the vascular highways are narrowed, stiffened, or inflamed. Erectile dysfunction is often the canary in the coal mine for broader systemic issues. A 2015 longitudinal study from Johns Hopkins found that men with mild erectile difficulties were 40% more likely to develop cardiovascular disease within 5 years than those without any symptoms. The arteries are far narrower than coronary or femoral arteries. They're the first to show signs of dysfunction when plaque or inflammation begins to build. So when tadalafil doesn't work, it may not be a failure of the drug, but a warning about your vascular health. Now, let's talk about hormones, specifically testosterone. Low testosterone doesn't directly block the action of tadalafil, but it absolutely affects libido and arousal, the very signals that initiate the erectile cascade in the first place. In a 2012 clinical trial published in the Journal of Clinical Endocrinology and Metabolism, researchers found that men with borderline low testosterone who were unresponsive to tadalafil alone experienced significantly better results when treated with a combination of tadalafil and testosterone replacement therapy. Let's not overlook the nervous system either. Erectile function is, in large part, a neurological process. Spinal cord injuries, diabetic neuropathy, or even subtle pelvic nerve compression from long-term cycling can interfere with signal transmission. Chronic stress, anxiety, or performance pressure can also trigger sympathetic overdrive, flooding the system with norepinephrine, which constricts blood vessels. Interestingly, tadalafil's long half-life, around 17.5 hours, means it maintains therapeutic levels for over a full day. This is especially helpful in men who experience performance anxiety, as it reduces the pressure of narrow timing windows and allows for more natural, spontaneous intimacy. And what about the downstream effects of mismanaging tadalafil? Let's be clear, tadalafil is generally well tolerated, but when misused by overdosing, mixing with contraindicated drugs, or ignoring underlying conditions, it can lead to complications. These may include persistent headaches or facial flushing due to vasodilation, back pain and muscle aches linked to PDE11 inhibition in skeletal muscle, hypotension, especially when combined with alcohol or nitrate medications, visual Visual changes, such as blue-tinted vision, though rare, these are related to PDE6 inhibition in the retina. Far more concerning, however, is the false reassurance that can come with over-reliance on the drug. When a man uses Tadalafil to power through without investigating why his erections are weakening, he may delay diagnosis of far more serious conditions. There are evidence-based interventions that go beyond the pill. For instance, aerobic exercise has been shown in a 2018 meta-analysis in the Journal of Sexual Medicine to improve erectile quality, especially in men with mild to moderate ED. Just 30 minutes of brisk walking 5 days per week showed measurable benefit. Weight loss improves endothelial function and testosterone levels, both of which enhance Tadalafil's impact. Smoking cessation dramatically reduces vascular resistance and increases nitric oxide bioavailability, which enhances PDE5 inhibitor response. Sleep optimization, particularly treating sleep apnea, restores testosterone rhythm and reduces sympathetic tone, both crucial to erectile health. Tadalafil is a powerful ally, but it works best when supported by a system that's functioning as it should. Think of it not as the engine, but as the turbocharger. It can enhance what's already there, but it can't compensate for a broken chassis. So now that we've covered the physiology, the pharmacology, and the hidden variables, what can you actually do today to make Tadalafil as effective as possible? Here are 7 strategies that can help you get the most from this medication while protecting your health in the long term. 1. Time it strategically. Don't rush the process. 2. Watch what you eat and drink. 3. Track your responses and patterns. 4. Review your medications with a physician. 5. Address the bigger picture, lifestyle and health status. 6. Check your hormones and vascular health. 7. Set realistic expectations and keep communication open. Tadalafil doesn't cause an erection. It enhances the body's natural response to sexual arousal. If there's no desire, no foreplay, or unresolved psychological strain, performance may still fall short. Erectile dysfunction is not just a performance issue, it's a health signal. Tadalafil can be transformative, but it works best when supported by awareness, action, and clinical partnership. This isn't about fear, it's about control. Understanding how Tadalafil works and what might be helping or hurting its effectiveness gives you the power to take charge of your health, not just in the bedroom, but across the board. As always, consult your physician or urologist before starting, stopping, or changing any medication. What works for one man may not be right for another, and the most effective treatment starts with professional guidance. What's been your biggest frustration or surprise when it comes to ED medications? Let us know in the comments. Your experience might help someone else. And if you found this helpful, don't forget to like, share, and subscribe. We'll continue bringing you science-based insights into men's health without hype, just honest answers.